about, oh my God, someone's gonna find I have strep, or, you know what I mean? But, I mean, other things, maybe, you know, be careful.
Right, right. It's true, because the privacy.
But that's
You
it,
know, I mean,
right,
yeah.
that's what I'm saying, I don't care if somebody goes like.
Kiosk, you know, entering information and. you know.
Right, well, that's it.
Yeah. Yeah. So, security, what about the security? It's just food for thought, you know, if you think about it, that now technology has changed the way that care is being provided, you know, and with those physician shortages and the healthcare worker shortages, you know, I can see where they're compensating for the need, but we want to make sure in our triad of healthcare that quality is still there. Of course, that improves access, right? And it probably is, I'm not sure how cost effective, so it could be more cost effective than, say, going to the hospital, the emergency room.
Right.
Absolutely, you know, but that quality, makes you wonder about the quality, so.
It sounds like it's just a temporary quick fix.
It could be. I mean, hopefully it's going to turn into a good thing, because I think that it's more convenient when you have people that have to travel 2 hours to get to a healthcare provider. They're more apt, or people that don't have health insurance, they're more apt to just essentially blow it off and I'll get better, I'll get better, I'll get better. And those issues could become worsened over time. But if you have it convenient and 15 minutes down the road, it could be a great benefit. So I'm not knocking it, but I'm just, where it's, I saw something in the news this weekend about CVS is really starting to go forward with getting more and more clinics into place, so.
They're finding it beneficial.
Are they
It must
finding
be.
it? Well,
They're gonna
this is like all new. This is all, it's essentially they're rolling these out. They haven't
We're talking
quite
about it on
completed each and every.
ABC with Diane Sawyer or whatever, did a thing on it. I don't know, maybe January, February, I can't remember, it was a little while back, but anyway, they did a thing on the news about it.
But
You know.
we haven't quite seen them all popping up yet.
Right.
And there was something in the news this
We
week.
had
I think
interviewed
they're
a
doing
mom
kind
that
of
had-
pilot. They've got some out there that they.
Yeah, 'cause this mom was like, you know, she's busy, she had 4 kids, and they all do sports, and her and her husband work, I mean, she says, I go to that all the time.
Wow.
With my kids.
Yeah.
You know, she says it's convenient.
I'll have to find that.
But yeah, it was
I'll
on
find it on
ABC.
YouTube.
Yeah, Diane Sawyer, I think it was, you know, in ABC World News, so it was like the 6:30 news.
Okay, thank you.
Yeah.
Check it out.
That's why I kind of was like relating to what you were saying, because I saw it.
Right. I mean, it's all these new things that are coming into play that are.
There's no waiting time.
What's that?
There's no waiting time right now.
No, absolutely not. Absolutely not. So, and it is, if you don't have health insurance, I mean, it's definitely, to go to a Minute Clinic and pay, I don't know exactly what they're charging yet, but I'm sure it's a lot less than going to an emergency department.
Well, you're not paying a facility fee.
Right. True, true. Okay, so in our guidelines, it actually brings up our Appendix C too, for some clinical examples of evaluation and management. So just keep that in mind. Take a look at a few of them, just get an idea of what they are. They're in Appendix C. Then we have some instructions for selecting the appropriate evaluation and management code. We kind of just went through that, but we talked about our key components and our factors that are involved and the different levels of examination. We talked about all of that. We're going to actually look at a case study in a couple of seconds so that you can kind of get a feel for evaluation and management coding. We're going to, of course, you have to determine the complexity of the medical decision-making, and at the bottom of that, there's a nice little table here that also breaks down our level of medical decision-making. You can either use the table in the PowerPoint that I handed out, or you can use this as well. And then we've got our evaluation and management services. It's broken down what they're based on. Of course, you know, we have all of the key components, or 2 of 3 of the key components. Those were the examples that we looked at. We want to be mindful of that when we're selecting the appropriate code. We want to make sure. All right, so what I'm gonna do is actually, we're gonna take a look at a case study. I'm gonna pass out a case study so that we can, or a clinical study, so we can abstract from this information our CPT code. I didn't know if you wanted me to after, but okay.
No,
You did?
yeah, that's good.
Well, you gave me the envelope and stamp, so. I figured you wanted me to do that.
Good. What do you think?
We'll do a couple of examples from this week's homework assignment too, just so you can get a feel for these, all right? You have the answers to the workbook exercises and the chapter review, so I figured we'd do a couple of questions from the homework together as a group. I printed them. You can kind of use that as a little worksheet tonight and just make sure you submit the homework assignment through Blackboard. But I will definitely want to make sure you get a grasp on these before I let you go. Okay, so in taking a look at this example, okay, what is our chief complaint?
Knee pain.
Knee pain, okay. This is an established patient, FYI. I think it got cut off there. It's an established patient. So we now have our chief complaint. What do you think that chief complaint is? Do you think that that chief complaint is, you know, pretty straightforward, don't you think? Don't you think that's pretty straightforward? All right, our review of systems. How many organ systems are we reviewing? One. Absolutely. So everybody sees that. Now we have our physical exam. Now remember, when we're talking about our physical exam, we're talking about the history of the present illness, right? So we're gonna take a look at our points here. Okay, we have the mild swelling of the left knee compared to the right. What are we doing here? Let's take a look at our 8 levels. What are we doing? Context, maybe? Context of pain? Severity, right? Or mild swelling? I think that we're putting quality, that could be quality. I'm just,
Aching for
if
like
you guys
2
want
weeks.
them. Some pain with passive rotation. Quality? Context? Context, absolutely. No overlying warmth or arrhythmia. We have no overlying warmth or arrhythmia. This essentially is our associated signs and symptoms, right? Even though there isn't an association, the physician still reviewed, right? Then we have our assessment. When we're talking about our evaluation and management codes and we're applying for the service that's performed by the provider, the assessment isn't always important because that is the outcome, right? So unless we're actually coding an EM service for, say, discharge services, that's really not hugely important when we're abstracting from the information to apply the code. So I'll give you a couple minutes, take a shot, take a look in the CPT manual. And remember, it's an established patient. Let's see where we go with this. electronic copy on Blackboard if you want to bookmark it, but this is a training that was offered by Medicare of evaluation of electronic. So inside of this, there's actually, again, the elements of examination are broken down. This is from Medicare themselves, so it's a really excellent tool and resource to have. This is one of those coders resources that go up on the bookcase until you need it. And you get stuck on one of those coding cases where it's an excellent tool, though. Handy little resource. How we doing on this one? Let me have it. 99212. Anybody have anything different?
I was waffling between that and 99213.
It is 99213. Why were you waffling, Matt?
Differing between problem and established problem.
I would technically do the codes too, mine was the expanded versus the
Problem focused.
examination.
Hopefully the next one in 2 weeks.
What's that?
The next one in 2 weeks would be the expanded.
Well, okay, so in taking a look at this particular scenario, for code 99213, okay, we would need 2 out of 3. Of course, this is broken down in your CPT manual, but 2 out of 3 of the following: the expanded problem-focused history, expanded problem-focused exam, and low-complexity medical decision-making, right? So, for this particular case that we had, if we take a look at it and break it down a little bit, we have to have 2 or 3 out of those components. For our history, in this example, we actually have 1 review of systems, right? We have 1 review of systems. We have actually, there was no past family social history performed in this. We have 2 elements of HPI. There were 2 elements of HPI. Did everyone abstract 2, or did you get 3? Did you have 2 elements? When we talked about that? The 2 elements we had were location, the need, and the duration. I might have thrown you off a little bit when I said, but we were considering factors. So